I'm here with you for HIT 452 Statistics and Data Analysis, so to speak. We are on week 1 and we are doing chapters 1 and 2, and this is the lecture video for chapter 1. If you look at your syllabus, you'll see that this week just this week, we're on unit objectives 9.1.1 through 9.1.10. And we're going to be talking about introduction to statistics. Maybe. There we go. All right. What are our learning objectives? We want to talk about healthcare statistics and why do we have them? What do we do with them? Why are you learning them? Assess the sources of data, compare and contrast between data and information, validity and reliability, descriptive and inferential statistics, primary and secondary data sources. And we'll also talk about the users of healthcare statistics. Now, some of these topics you've had before in other classes, but this is where we're really going to focus on quite a bit of these. Now, this is an introduction chapter, and really the meat of this textbook is on all the formulas. And you won't get formulas until next week. So let's go ahead and dive in. Statistics. Statistics are numbers computed from a larger collection of numbers which collectively constitute a sample of data. So a sample is a small part or a subset of a larger group of data that's a population, and statistics are from those. They're also considered a branch of mathematics concerned with collecting, organizing, summarizing, and analyzing data. Statistics originally referred to the collection of information about and for the state, which makes sense if you think about it. It is the numbers of the state. And so we're gathering information, multiple numbers, and it's all related around a specific topic that is usually of interest to the state or to the federal government or to the organization, the healthcare organization that we're talking about. So why do we study statistics? Why do we make you study statistics? Why do I have to teach statistics? Well, we need them for decision making. You'll find that once you get out into the world, you may not utilize these specific statistics quite often, but they are helpful to know and understand. And in some jobs, they are absolutely critical. Decisions are made based on statistics. And so in order to do that, we need information. We need to find out why patients come to the facility. What is the cost of taking care of them? What is the quality of care that was provided? Are we meeting the requirements of our accrediting agencies, whether that's federal, state, or Joint Commission type organizations? Are we making sure that we're prioritizing needed services? And are we maintaining our physician specialty mix? We also do it for public health reasons. There are certain public health requirements on us by our state or by the federal government that we have to report statistics. They're looking at individuals who need services and are being provided services. They want to promote quality of life through prevention and control of disease, injury, and disability. Health statistics basically provide information about the health of people and their utilization of healthcare services. So the figures used in statistics must be relevant and reliable. Now, if you're following along in your book, we have reached the point of page 2, I believe. Yes, we are on page 2. So if you want to follow along, that's where we're at. It is important. Remember, statistics, in order to be used, need to be relevant and reliable. So they need to be applicable to whatever it is that we're doing, and they need to be consistent. They need to be trustworthy. So on page 3, it talks about descriptive versus inferential statistics. Descriptive statistics describe what the data shows about the characteristics of a sample. It tells information about a particular population, whereas inferential statistics help us make inferences or a guess about a larger group of data or population by drawing conclusions from that smaller group. Now I'm going to stop here and say, hint, 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 This is on your quiz. Make sure that you understand what descriptive statistics are and inferential statistics, how they are similar, how they are different, and what they are, because you'll need to know that information. You need to know those definitions. Where do we get this health statistic information? Well, we get it from primary and secondary data sources. Do you remember this? We studied about these. Primary is the health record. It is the source, the ultimate source. It's vital statistics, census, health record. It is facts about patients. Secondary data sources are derived from those primary sources, and those are data warehouses and databases, and that they are then used to guide hospital operations. So you're taking the basic health facts about the patient, you're deriving data from that, and then it's used to guide those hospital operations. And again, you need to know this information for your quiz. All right, where do we get health statistics? They come from censuses, facility departments, and vital statistics. And they give us some examples here. We are now on, I guess you would say pages 3 to 4. I would say a little bit more page 4, but that's okay. A census is a count of the people in their location. So example of a census is a U.S. census that happens every 10 years. Another example might be a hospital census, where they're tracking the number of patients that are in the hospital and which units they're on or which patient type they are, whether they're inpatient, observation, are they in the ICU, are they on a med-surg unit, are they on an OB unit, are they in a nursery bed, those types of things. Facility departments keep counts of patients seen and the reason. So again, I would say number of patients in the ICU is not really, that can somewhat be census based. But like the OB or surgery, they're required to keep logs. And those are electronic these days, but they're required to keep counts of patients, which patients, what were they seen for, what was their reason. ED is another department that would be an example here. Then you get into vital statistics, and this is birth and death primarily. So who uses these health statistics? Well, there's a lot of people that use them. Healthcare administration, healthcare department managers, HIM directors, cancer registries, nursing facilities, home health agencies, hospice, mental health facilities, all these. As an HIM director, you use them, you use the census, and you use admissions and discharges and different things to determine workloads. What are your workloads going to be? If you have a big bump in census, you know that in 2 to 3 days, that's going to be hitting your coding queue, and you know that you're going to need to make sure that that bump is going to be taken care of. Whereas, okay, maybe you've got a surgeon who's gone on vacation for 3 weeks, and this surgeon is one of your busiest surgeons that you have, and you know your OR caseload's going to drop. So you're going to want to, again, keep that in mind in terms of coding. Maybe if you've got a surgery coder, you might switch them to doing a different type of coding that they're capable of doing, or encouraging them that if they're going to take a summer vacation, they might want to set it for the same time that this major surgeon does. So there are lots of people that use health statistics. They use them for a lot of different reasons. Case mix index is used to identify coding, use of MCCs, CCs, also how many surgical patients versus medical patients, all sorts of things like that. So it's used in a variety of ways. And it's used, again, not just in an inpatient setting, but an outpatient setting. As you can see here, it talks about registries, facilities that are outside the hospital, and that any type of patient care, basically. Drug and alcohol facilities, outpatient facilities, managed care organizations, payers, healthcare researchers, accrediting agencies, the government. Everybody uses health statistics. Everybody. And that is it for chapter 1. So chapter 1 is pretty short. You ought to be able to fly through it. And I will be back shortly to talk to you about chapter 2.